Hello, and welcome. Today we're diving into a common ailment that affects the voice, laryngitis. We'll explore what it is, what causes it, and how it's treated. Let's get started. Laryngitis, at its core, is inflammation of the larynx or voice box, the most frequent culprit. Viral infections, often the same viruses that cause the common cold or flu. But bacterial infections can also be responsible, though they are less common. Other potential causes include excessive voice use, like shouting or singing for extended periods, irritants such as smoke, allergens, and chemical fumes, and acid reflux, where stomach acid backs up into the esophagus and irritates the larynx. When the larynx becomes inflamed, the vocal cords within it swell. This swelling interferes with their normal vibration, which is essential for producing sound. Because of this impaired vibration, the voice becomes hoarse, weak, or even disappears entirely. The inflammation can also cause pain and a raw feeling in the throat. The severity of the symptoms depends on the degree of inflammation and the underlying cause. Laryngitis is a widespread condition, affecting people of all ages and backgrounds. As viral infections are a major cause, it's particularly common during cold and flu season. Those who frequently use their voice professionally, such as singers, teachers, and public speakers, are at a higher risk of developing laryngitis due to voice strain. The hallmark symptom of laryngitis is a hoarse voice. Other common signs and symptoms include a sore throat, a persistent cough, a constant tickling sensation in the throat, difficulty swallowing, and sometimes even a mild fever. In severe cases, the airway can become swollen, leading to difficulty breathing, though this is rare. If you experience difficulty breathing, seek immediate medical attention. Diagnosing laryngitis typically involves a physical examination by a doctor. They'll listen to your voice and examine your throat for signs of inflammation. In most cases, the diagnosis is straightforward. However, if symptoms are severe or persistent, further tests, such as a laryngoscopy, may be needed. A laryngoscopy involves using a small camera to visualize the vocal cords and rule out other potential causes of hoarseness, like vocal cord nodules or polyps. Laryngitis can be broadly categorized into two types: acute and chronic. Acute laryngitis comes on suddenly and usually lasts for a week or two, often accompanying a cold or flu. Chronic laryngitis, on the other hand, persists for more than 3 weeks and is frequently linked to long-term irritants, such as smoking, acid reflux, or chronic voice overuse. Treatment for laryngitis largely depends on the underlying cause. In most cases of acute viral laryngitis, rest and supportive care are the mainstays of treatment. This includes resting your voice, drinking plenty of fluids to stay hydrated, using a humidifier to moisten the air, and taking over the counter pain relievers for any discomfort. If the laryngitis is caused by a bacterial infection, antibiotics may be prescribed. For chronic laryngitis caused by acid reflux, medications to reduce stomach acid may be recommended. In cases of chronic voice overuse, speech therapy can be beneficial. Preventing laryngitis involves minimizing exposure to its known causes. This includes practicing good hygiene to avoid viral infections, avoiding smoking and exposure to other irritants, managing acid reflux with lifestyle changes and medication, and practicing proper vocal techniques to prevent voice strain, especially if you're a professional voice user. The prognosis for acute laryngitis is generally excellent. Most people recover fully within 1 to 2 weeks with rest and supportive care. Chronic laryngitis can be more challenging to manage, as it often requires addressing the underlying cause and making long-term lifestyle changes. Recent research is focusing on developing more effective treatments for chronic laryngitis, including targeted therapies to reduce inflammation and improve vocal cord function. Stay tuned for future advancements in this area.